I am pleased that this committee put this timely and important hearing together today. Understanding the cost of healthcare services in advance empowers patients to make informed decisions for their families, better manage their healthcare finances, and advocate for fair and reasonable healthcare costs. Like many of my colleagues, the cost of healthcare is one of the top issues that I hear about from my constituents back home in central and northwestern Illinois. Enacted in 2020 with strong bipartisan support in Congress, the No Surprises Act, which we've heard about today, has largely been a success in providing certainty for patients when receiving care. Because of this committee's bipartisan work and leadership, today patients in every state across the country are better protected from most surprise medical bills. While this committee made great strides towards protecting patients from costly and unnecessary out-of-network costs, we have unfortunately seen agency officials bypass congressional intent on surprise medical billing protections, which ultimately harms patients' access to care. In rural counties, in my district, access and choice for healthcare services can be a significant challenge. Flawed implementation of the No Surprises Act has reduced patient access to care, which in particularly has affected rural and underserved areas. As I visit with my rural healthcare providers, they continually stress the fact that IDR process has been virtually inaccessible for small practices, given their limited capital availability compared to many large and urban practices. Hospitals and healthcare facilities should be focused on delivering needed care and services, not worrying if IDR billing process costs outweigh any benefits for patients and providers. The No Surprises Act was carefully drafted so as to not tip the scales in favor of one party over the other. And my hope is this committee and the executive branch can work to remedy this imbalance. My question for Mr. Bobeck and Mrs. Thornton, in your testimonies, you both mentioned the need to look at the IDR process and how reforms in this space would better allow dispute filing and compliance with the No Surprises Act. Can you both expand on what could be done by CMS to improve the functionality of IDR process to streamline and to reduce burdens on the parties? Mr. Bobeck.
Congressman, thank you very much for the question. The first thing that can ultimately be done is regarding the batching process. As many of the Congress members know, batching is a process by which different disputes can be put together. Right now, the process does not follow normally how providers and payers bill each other. They usually bill in an episode of care. Somebody comes in, there's various codes associated with giving that care, and then they be paid upon that. That's not how the batching process works right now. CMS is currently undergoing the batching process and changing those rules. Making those rules more in tune with how people bill would be a very good step in the right direction. Additionally, one of the biggest things that can be done is ultimately the portal itself. With more implementation of the portal, making more fields more clearly defined, parties can provide better information, and the more information and the better information they will provide, you will get a more streamlined process that will have decisions happening at a much more rapid rate. For our perspective, we have run various algorithms on our own end, and we can see very clearly that the better the data that's put into the system, the better the outcomes that will come out. Thank you.
Thank you. Ms. Thornton, do you have anything to add on that?
I 100% agree with everything that he just said. I think technology can really help streamline this process.